For many years, we've heard and discussed breast cancer awareness in October. Now, I don't think there's any family that doesn't know someone who has had such an experience. And over the years, the awareness of breast cancer has been extremely important to prevention of this particular ailment affecting families across Africa. It's Breast Cancer Awareness Month once again, and we're joined by Dr. Modupe Elebute-Odunsi. Now, she is the co-founder and CEO of Marcel Ruth Cancer Center and Specialist Hospital. She's also founder and chairwoman in Healthcare Network, Women in Healthcare Network. It's great to have you here on the couch with us. Welcome.
Good morning. Thank you for having me.
Thank you for taking our time from your extremely busy schedule to talk to us about this. It is a topic we've heard about over and over again, but we cannot stress the importance of continuing to speak about this. But what are the new realities when it comes to breast cancer?
I think the biggest reality is that worldwide, screening and early detection makes a significant difference to how people respond to treatment and their overall outcome. So in simple terms, if somebody presents very early on, when she just found a lump, for example, when you're having a shower or when you're doing your monthly checks, where all women are supposed to examine their breasts every morning when you're in the shower, then even if the diagnosis is cancer, the treatments are very effective and the patient can be cured of the cancer and live a normal life, and that's for sure. But if somebody ignores the lump or doesn't know what to do about it, or goes somewhere and doesn't progress with the investigations and get treatment early, and they present with advanced cancer, then it doesn't matter what treatments we have available, there's not actually much that we can do about it.
Okay.
And that's obviously can be quite sad. So I know it sounds like it's repetitive, but you can imagine that particularly in our country where we have 200 million people, in majority of whom are, I think, women, we do need to continue with this message. Also, because we don't have a structured screening program like in other parts of the world, where when you get to age 40 or age 45, you get a letter in the post or an SMS on your phone saying you need to go and have your mammogram.
Okay.
We don't have that system. So it falls on us and people like you, thankfully, thank you very much, to help us with that message. That, you know, it is, if you notice anything in your breast, if you notice a lump, if you notice something that looks like a wound, if you notice a discharge from your nipple that's not meant to be there, if any area is cracked and is not healing, all those things. I mean, just be an ordinary infection, it could just be dryness, but if it persists for up to 3 weeks, then you should definitely go and see a doctor and get it checked out.
Okay. Now, I feel like it's our responsibility to check ourselves.
Yes.
But it does feel like there's a certain level of doubt or stigma or the God forbid factor that is affecting a lot of women, or let's say families now, from actually going for further investigation. Can you give us some statistics? Are people coming more to get checked or less in these days?
Oh, definitely people are coming more.
Okay.
And honestly, it is as a result of, you know,
awareness.
Not just from the medical point of view, but in particular, as you know, social media, is helping us quite a lot. And people are presenting, and they're presenting earlier too.
Okay.
There are lots of NGOs, there are lots of churches who are helping with this drive with awareness.
Sure.
But Titi, the first thing I want to say also is that, you know, breast cancer is not just limited to women. Men also get breast cancer. And that's one thing I think that I always want to stress when we're talking about breast cancer.
Okay.
Because when men then notice a lump, they ignore it because they don't think that it could be breast cancer. But we have got men who have breast cancer as well. But definitely people are presenting more. People are presenting earlier, which is fantastic.
Which likely means that they're healing more. They're getting healed or cured of it more.
Well, I mean, they present earlier. Now, in our environment, we also have a number of other concerning issues.
Okay.
Sometimes people don't progress with their treatment because they may go to church and then they were told that, oh, we prayed about it, it's gone away, don't go back. Some people, there's herbal medicine going
Yes,
on. And then, as you mentioned just now, there's the stigma.
Yeah.
And also, as you can imagine, for a woman in a marriage or in a relationship, to be, there's a huge amount of concern about, if I tell my husband, or even if they start going to the hospital and then they're told they're going to need maybe chemotherapy and their hair's going to fall out. But also, it's the surgery that worries women most.
Okay.
I'm going to lose my breast. Who am I going to be after this? What am I going to be to my husband, my children? I've just come back from a meeting in the US, and even there, there's a huge section discussing the body image after treatments for breast cancer and what we could do about this to make it more acceptable for people to receive treatments.
Sure. I have to say that I've always done what I can to see myself as the person inside, not just physically. But we cannot push aside the body image factor. I actually have a friend that went through it, but thankfully she had the finances to do full reconstructive surgery after removing all the affected tissue. But the issue of going under the knife these days, in 2024, is going under the knife as difficult, scary, as risky as it was, let's say, 5 years ago?
No, it's not risky, but if consider that sometimes when somebody finds a lump or has this diagnosis, it might be their first time of even ever seeing a doctor or even accessing healthcare. Or maybe all they've had before in the past was a chest infection. And now suddenly you're saying, one day I'm going to work or I'm on TVC and tomorrow you're telling me that I've got cancer. It's a huge word. And also the first thing that comes to people's mind is my mortality. Am I going to die? So there's a lot of concern about that. But like I said, with breast cancer specifically, even in settled marriages and there is that concern that if I lose my breast, who will I be after this? But like I said, for us this month, October is such a great month, and I think the whole thing about wearing pink or that awareness and that encouragement for people to examine themselves, and if they have a problem, to present for care is what we need to be driving this month.
So it is October Breast Cancer Awareness Month. Dr. Elebute has given us some information, and it might be for you or a friend or a family member. Please go and get checked out. You never know what you might be catching early enough to deal with it. All right, then we have to take a quick break. Thank you so much, Doctor. We have to take a quick break. We will be back after this.